Hi everyone, my name is Janis and I've worked at the Korean Community Services of Metropolitan New York, Inc. for the past 3 years as a part-time project coordinator. I've worked for the NYCEAL grant for the past 2 years doing COVID-19 community outreach, community COVID testing, and participating in health fairs. Korean Community Services' mission is to be a bridge for Korean immigrants and the wider Asian community to fully integrate into society and overcome any economic, health, and linguistic barriers so that they become independent and thriving members of the community. We accomplish this mission by providing culturally competent programs in the areas of aging, education, immigration, workforce development, and public health and mental health. At the Public Health and Research Center at KCS, we focus on helping the community with disease prevention and screenings. We also provide resources and services to help clients manage their health. We currently provide hepatitis B screening, mammograms, and assistance with food and nutrition services such as SNAP, medically tailored meals, and chronic disease self-management programs. We also do other cancer-related research and studies with our partners. We work with our partner CBOs for events and health outreach to engage with the community. We work with mainly the Asian population, such as Koreans and Chinese, in the communities of Bayside and Flushing. The best way to engage with these populations or with these communities is to have cultural sensitivity, cultural humility, and to be able to speak in the same language as the people you're outreaching to. This enables you to work directly with the clients and be personable. When doing community outreach or events, it's also important to provide incentives or benefits to those who participate and engage with you, such as small token items like tote bags, t-shirts, and could be personal protective equipment. Incentives tend to earn people's interests, and it's also important to have visibility in the community. The more regularly you outreach in the community, the more people become familiar with you and also become familiar with the work that you do. Researchers should be aware that many members of the community are more receptive towards culturally tailored messages or when framed with culture. Researchers should also provide legitimacy and credibility when engaging with the community. For example, we have cultural events at KCS where we provide our health events, suggest health screenings, and give more health information. Also, many individuals, when given the chance, are open to telling you their story. There are many people who would love the opportunity to use their voice to vocalize their concerns for themselves and the community. But you have to display empathy towards them. Accessibility is also an important consideration. People should be easily able to travel to these sites to participate in the research. Events and resources should be provided in convenient locations. There were many good experiences that I had when outreaching in the community. I learned when engaging with community members. I felt good disseminating information that people found helpful, distributing personal protective equipment and masks during the time of the pandemic, and participating in vaccine clinic events. We also have some experiences that highlight the importance of staying safe when outreaching. One time during the pandemic in 2022, some members of the outreach team who were in Queens encountered a person on the street who they tried to help, but they were cursed out. Another time in Jackson Heights, while our team was outreaching and providing COVID-19 resources, a man who was opposed to the COVID-19 vaccination parked his truck and held a protest by blocking the roadways and starting to blast anti-vaccine audio. Sometimes outreach can be met with reactions from community members who do completely erratic things and make us concerned for our safety. And other times there were instances where we were faced with racism. An outreach member who was Chinese was told to go back to his country by a random passerby while we were giving out resources. So we have a wide variety of experiences. Community members do hold misconceptions. Some community members may have misconceptions about research, especially members of ethnicities that have historically been recruited to participate in research without their consent. Others also don't understand what participating in research may mean. They don't know how their participation will improve our understanding of treatment. The best way to address this is to have an outreach member who is of the same culture as the community, who can answer questions and dispel misinformation. It is good to understand what kind of misinformation is held in the community and be prepared to inform people about the facts. It's important to focus our messaging and focus on issues that community is currently concerned with. Things like heart disease, cancer, and mental health issues are at the forefront of the public health issues. It would be great if we can offer public health education to the community and provide opportunities for them to be more informed. Things like workshops can engage communities in a more interactive and focused way. I'm Janis from the Korean Community Services of Metropolitan New York, Inc., and thank you for listening to my testimonial for the Community Engagement in Clinical Trials Toolkit.